Today we will explore the causes necessitating a liver transplant and gain a thorough knowledge. A liver transplant is a surgical procedure in which a diseased or damaged liver is replaced with a healthy liver from a deceased or living donor. The liver is a vital organ that performs many important functions, such as filtering toxins from the blood, producing bile, regulating glucose levels, and producing clotting factors. When the liver is damaged or diseased, it can no longer perform these functions properly, leading to serious health complications. There are several indications for a liver transplant, including end-stage liver disease, ESLD. This includes conditions such as cirrhosis, hepatitis, and liver cancer, in which the liver is no longer able to function properly. In cases of ESLD, a liver transplant is often the only treatment option. Acute liver failure. This is a rare but serious condition in which the liver suddenly stops functioning. Causes of acute liver failure include viral hepatitis, drug reactions, and other toxins. A liver transplant is often required in cases of acute liver failure to save the patient's life. Metabolic liver disease. This includes conditions such as Wilson's disease, in which the liver is unable to process certain substances properly, leading to damage. A liver transplant may be required to correct the metabolic disorder. Biliary atresia. This is a congenital condition in which the bile ducts are blocked or malformed, leading to liver damage. A liver transplant may be required in severe cases of biliary atresia to correct the condition. Liver tumors. In certain cases, a liver transplant may be required to treat liver tumors, particularly if they are malignant and cannot be removed surgically. The process of getting a liver transplant begins with a thorough evaluation by a transplant team to determine if a transplant is the best option for the patient. The evaluation includes a medical history, physical examination, blood tests, and imaging tests. The patient's psychological and social support system will also be evaluated to ensure that they can handle the emotional and physical demands of the transplant. Once the patient is deemed eligible for a transplant, they are placed on the National Transplant Waiting List. The waiting time for a liver transplant varies depending on the patient's condition, blood type, and location. In some cases, a living donor transplant may be an option, in which a healthy person volunteers to donate a portion of their liver to the patient. The surgical procedure of a liver transplant is a complex and delicate one that requires a team of experienced surgeons, anesthesiologists, and other healthcare professionals. The surgery typically takes between 4 to 12 hours and is performed under general anesthesia. The first step in the procedure is to remove the diseased liver from the patient. The new liver is then placed in the patient's body, and the blood vessels and bile ducts are attached to the new organ. The patient's own blood vessels and bile ducts are then used to connect the new organ to the patient's body. After the surgery, the patient is closely monitored in the intensive care unit, ICU, for several days. The patient may need to stay in the hospital for several weeks to recover from the surgery. The recovery time varies for each patient, but most patients are able to return to their normal activities within a few months. There are some risks and complications associated with a liver transplant. These include bleeding, infection, blood clots, organ rejection, and complications from anesthesia. The risk of complications is higher in patients who have other health conditions such as diabetes, heart disease, or lung disease. However, with advances in surgical techniques and immunosuppressive therapy, the success rate of liver transplant has improved dramatically. What did you learn in this video? Please leave a comment below. and I will answer it. Also, let me know what topic you would like us to cover in the next video.